بسم الله الرحمن الرحيم. استكمالا للمحاضرات Psychiatric symptomatology, we'll continue in the disorders of emotions and affect. Disorders of affect either quantitative or qualitative. Quantitative disturbance of affect means change in the amount of affect either by increase or by decrease. Decreasing affect is called inadequate affect. And two types of inadequate affect we see: apathy and indifference. Indifference means loss of emotional expression with intact emotional experience. So the patient can feel, but he has difficulty to express his feelings. This is indifference. Another severer degree is apathy, where the patient loses both emotional experience and expression. So the patient neither feels nor expresses his emotions. Qualitative disturbance of emotion of affect is exampled by what we call inappropriate affect or incongruity of affect, which is simply a disharmony between affect and thought. So you can feel something contradictory to what you think about. Like in this picture, this person informs somebody that he already succeeded and he is congratulating him while he is expressing painful emotions as appearing in his facial expressions. Ambivalence is another qualitative disturbance in affect, where the patient holds two contradictory emotions or two contradictory affects toward the same thing. For example, he hates something, at the same time he loves it. And this is normal in children, where the child may feel loving his toy which he plays with, but because this toy prevents him from eating, suddenly he throw it or destroy it and will cry and go to eat. So he loves and hates the same thing. And this type of emotions, by maturity and development, will gradually fade out and replaced by appropriate emotions. In schizophrenia, there is regression to the childhood period, where the patient may have again ambivalent feelings. Sometimes we see patients suffering from low mood or sad or bad emotions, and one form of this is what we call grief reaction or mourning, when the person loses a dear friend or a close relative, and he feels sorry for that. These feelings, this sad feeling is normal, but sometimes the grief reaction is delayed and continued for longer time than in the normal situation. Depression is invasive or pervasive feelings of sad mood. Usually it is a psychopathological phenomena associated with other psychological and somatic disturbances in the syndrome of depression. Pleasurable affect we have examples of pleasurable affect, like for example euphoria, in which there is heightened feeling with feeling of psychological well-being inappropriate to the situation and cannot be explained by external environment, usually associated with substance abuse. Some substances are used to have this form of euphoria, like stimulant drugs. Elation is another form of pleasurable affect where the patient feels intense happiness undue, meaning that it is not explained by any external events or external environmental event, and usually associated with a sense of self-confidence, over self-confidence, and some sort of motor hyperactivity, and occurs in mania. Anxiety is a state of feeling uneasiness, uncertainty, or dread resulting from a real and sometimes perceived threat. So the patient may respond to threat, whether real or perceived. I mean, he may think that there is a threat while in fact there is no, by feeling of sense of uneasiness, uncertainty, and feeling of fears. Free-floating anxiety, we have forms of anxiety. One of them is generalized free-floating anxiety. It is generalized and pervasive fear and not attached to any idea. There is no found any source, understandable source for this type of fear or anxiety. It's called free-floating anxiety. Sometimes patients may feel tension. Tension is an unpleasant feeling associated with physical and psychological tightness. And most of the people express this feeling as some sort of chest tightness. المريض يقول لك صدر ضيق الصدر. Panic is sudden, overwhelming accumulation of anxiety occurring suddenly and in bouts, where the patient may suffer severe sense of fear amounting to disorganization and associated usually with a feel of impending death. Most patients express the panic attack as a death impending situation because it resembles the heart attack. Apprehension is a state of intense fear of any non-fearful stimulus. Like, for example, some people may have severe apprehension, fear of cars for possible car accident. Fear is a reaction to specific danger, and this is normal unless the fear is too much in relation to the provoking situation, and in that case it will be called phobia. So phobia is an intense irrational fear of an object or situation or place, and the fear is and the phobia is named according to the provoking object or situation. For example, agoraphobia, claustrophobia, hydrophobia, canophobia, zoophobia. So according to what provoked the fear, the phobia name is given. We have tens of names for phobia. Motor activity disorders or behavioral disorders, or what we called before conation or conduct. We can have motor activity as a quantitative disturbance in terms of increased motor activity or decreased motor activity, and we can have also qualitative disturbance of motor activity, usually referred to as catatonic symptoms. Motor activity can be increased and be called hyperactivity. Hyperactivity can be seen in different forms. One of them is agitation. The patient is restless, cannot keep still, cannot sit calm or comfortable, and usually he is pacing and going around with a tone of tension and anxiety. This is called agitation. It's common in depression, and depression, when agitation is prevailing, the picture is called agitated depression. Another form of hyperactivity is excitement, and here the hyperactivity is extreme and very excessive and purposeless. The patient moves too much but with no purpose, with no aim, and sometimes is destructive and may be dangerous to the people around. Compulsion is uncontrollable impulse to perform and act repetitively. The patient may be compelled or forced to do action he is not thinking about, so he performs the action without thinking, and it is repeated every now and then, and that is seen in some behaviors like pathological gambling or pathological theft, اللي هي مرض السرقة والكليبتومانيا, pulling hair, pyromania, setting fire, and these types of compulsive behavior. Repetitive activity can be repetitive in different forms. One of them is stereotypy. Stereotypy means monotonous repetition of certain movement without purpose. And it is a purposeless, monotonous repetition of movements. The patient repeat the movement in the same sequence, in the same form every time, and he has no any purpose of these movements. In mannerism, in contrast to this, mannerism are repeated movement, but usually have a purpose, and they are not monotonous. And each time the action may be slightly different from the previous action, and usually signifies some personal or some psychological they have some psychological significance or personal significance. In waxy flexibility, you can put the patient in whatever posture or position you want, and he doesn't offer any resistance to any posture imposed on him. You can put him in lying down position or in standing position, or you can raise his hand over his head, and he will keep the position you put him in for hours, even beyond the threshold of normal fatigue. You can sit the patient or put the patient in certain position and leave him for hours, and then you come back and you will find the patient in the same position you put him in, So as if the patient is a statue of wax. You can change him very easily. There is no any form of resistance. A frequent opposition to suggestion is what we call negativism. So negativism is a form of action done by the patient negative or contradictory to what he is asked to do. For example, you ask him to stand up, he will sit down. You ask him to go and close the door, he will open the door. This is called negativism. Inversely, echopraxia means that the patient imitates repeatedly the movements of other persons. It's mirror image behavior of the people around. We have also to remember that echopraxia is repeated movements imitating the movements of others, which in speech we have the same symptoms, but in speech and we call it echolalia. We mentioned before. Automatic obedience is the automatic obedience of the patient to simple commands in robot-like fashion. The patient may be like a robot machine. Whatever order you ask him to do, he will automatically do it without thinking. Impulsiveness is an action that is sudden, abrupt, and unplanned, no thinking, and it is directed towards immediate gratification. So it is related to gratification of desires and impulse and the psychological need. It is common in children. When they feel hungry, they will cry and they will impulsively shout, but it can happen in adults in different disorders. Psychomotor retardation is a quantitative disturbance of motor behavior in terms of decreased motor behavior, where the motor actions are slow, weak, and delayed, and this is observed obviously in depression and sometimes in schizophrenia as part of the catatonic symptoms, whether in the catatonic syndrome, catatonic disorder, or catatonic type of schizophrenia. By that, we come to the end of the symptomatology in psychiatry, and this is very important part of psychiatric study, because if you understand the symptoms well, it's very easy to understand the psychiatric syndromes, because we will just enumerate later on in each psychiatric syndrome these symptoms again and again. Thank you very much, and you will find a PDF file attached to this presentation with more details. Thank you.